Hello there, my name is Erin and I'll be your nurse today. What brings you in today?
I've had some nausea and vomiting and abdominal pain, some sweats and anxiety.
Okay, and before we start, can you tell me your name and your date of birth?
Barbara Dolan, 7/13 of 1940.
Okay, and when did all this pain start?
Just this morning.
Okay, and what kind of pain is it? Is it sharp? Is it stabbing? Can you describe the pain?
It's more when I'm like laying down on my back, it's kind of a sharp pain, but when I sit up, I feel a little bit better.
Okay, and have you ever had this pain before?
No, I just had it this morning.
Okay, and so it started this morning?
Mm-hmm.
Okay. Have you taken any medicine to help you get over the pain?
No.
Okay. Well, I'm going to take some vital signs and do an assessment and ask you a few more questions, and then we can go from there. Okay, I'll start out by listening to your heart and lungs. You can just sit there however is the most comfortable for you. Okay, and now can you take a deep breath for me? And again. And again. One more time. Alright, I'm going to come around to the back here. I'll have you take 6 deep breaths each time I move my stethoscope. Alright, and 2 more times. Okay, last time. That all sounds good. Do you have a cough at all?
No.
Okay. And I'm going to listen to your stomach. Okay, I'm going to push on it and tell me when it hurts and rate it on a scale of 1 to 10. Right there. Okay, and on a scale of 1 to 10, how bad does that hurt?
Like an 8.
Okay. I'm just going to feel your pulses here. And begin on your feet. Just going to take your socks off. Would you like your socks back on?
No, they're okay.
Okay. Just going to check your capillary refill here. Okay, and now we follow my pen light. It's going to be bright. Alright, I'm going to cover one eye. And the other eye. Okay, now follow my pen light with your eyes. Have you been having any nausea or vomiting with this?
Yes.
Okay, and are you actually vomiting, or is it just like motion sickness or dry heaving?
I vomited a couple of times, but most of it's just dry heaving.
Okay. Well, your blood pressure and your heart rate is a little bit elevated, and you have a temperature. That was when you were in the clinic, so I'm going to retake all this. So I'm going to take your blood pressure, and I'm going to put a pulse oximeter on your finger, check the O2 sats. I'm just going to document a few things here, and then I'm going to ask you a few more questions, just to get a better idea of what we're all dealing with here. Do you have any allergies that you know of?
No, not that I know of.
Okay. And if something were to happen to you, you'd like to be a full code?
Yes, please.
Okay. And you're not diabetic?
Mm-mm.
Okay. When was your last bowel movement?
Yesterday morning, probably.
And it was normal for you?
Yes.
Well, some orders that I have while you're here are, so I have some morphine for pain that I can give you, based off of last time. You can have it every 2 hours, and you had it 2 hours ago, so I can give you that. And then for your nausea and vomiting, I have some Zofran, that helps with that, so I can get you that too, but everything else is too soon to give. Do you have a cough at all?
Mm-mm.
Okay. Let's see here. I'll have you squeeze my hands for me. Okay. And do you know where you are today?
Yes.
Okay. And can you tell me which day of the week it is? That's okay if you're a little confused. Alright. Do you drink alcohol at all?
Yeah, I have 2 or 3 every day. Well, maybe like 4 or 5 every day.
Okay. And that's on a daily basis?
Yeah.
Okay, due to that answer, I'm gonna give you this questionnaire here. It's called a CAGE questionnaire. It's just for you to fill out, and you can just answer the questions honestly. Nothing that you answer will go against you. Everything that we take care of here at the hospital is confidential, so we can't report you to any police officers or anything. So we're here to help you and get you the help that you need. Okay. And based off of these answers, I am gonna have to ask a few more questions. So we, one of the first questions was, have you ever tried to cut down on your drinking? And you said yes to that. When was the last time you tried to cut down on your drinking?
Well, I just wonder every day about how much I drink, but the last time I tried was probably a couple months ago.
Okay, and you said that you get annoyed at others criticizing your drinking?
Yeah, sometimes they just keep bothering me, but it makes me want to just drink more sometimes.
Which is understandable, I totally get that. And you've never felt guilty about something that's happened while you're drinking? Okay. And have you ever taken a drink in the morning following an episode of drinking? You said yes here, is that correct?
I think so. I can't really remember.
Okay. And so according to this, you've answered yes to 3 of these questions. So we have some facility protocol that we're gonna follow. And one of those things is I'm gonna ask you some questions. It's a CWA scale. It's used to help with determining your withdrawals of drinking. So you said that you have some nausea and vomiting. Would you say that it's mild nausea with no vomiting, constant nausea and frequent dry heaves and vomiting? Okay. And tremors, do you ever find yourself shaking, or can you stick your hands out and, okay, and there's nothing noticeable there. Can you flip your hands over? Your palms are a little sweaty, okay, note that. Do you feel like your fingertips are shaking on the inside even though they aren't?
Not really.
No, okay. And then would you say that you're anxious at all? Moderately, mild?
Maybe just mild every now and then.
Okay. And agitated? Do you get agitated easily?
Not really.
No? Okay.
Just when they bug me about drinking, sometimes I do.
And I see you're sweating a little bit and your hands were a little sweaty. Does that happen very often?
Yeah, my hands get sweaty quite a bit, but I don't usually sweat very often.
Okay, and can you tell me what day this is?
Today?
Yes, what day is it today?
Monday.
Okay, and do you know where you are?
The clinic.
Okay. Have you ever experienced any itching, pins and needle sensation, burning or numbness, or feeling like bugs are crawling under your skin?
No.
Okay. Are you aware of any sounds around you? Do they startle you? Does anything disturb you?
Yeah, sometimes I hear some stuff.
Okay. And would you say that you're startled pretty easily?
Yeah.
Okay. And then does the light in here appear to be bright to you at all? Does it hurt your eyes, or are you seeing anything that disturbs you or that you know isn't there? Okay.
It's not bad.
And does your head feel different than usual? Does it feel like there's something, a band around your head, squeezing your head?
Yeah.
Okay.
Feels
Is that
kind of
severe, moderate, or mild?
Moderate.
Okay. Okay. Well, I'll put all this into our system, and it'll give you a score, and then according to our protocols, that'll give us different medicines that we can give you and how often we'll monitor you. We do continue to ask these questions depending on your number based on the scale, and we'll just keep checking on you. Have you ever had any thoughts of committing suicide?
No.
And do you have a plan if you ever have thought that?
No.
Okay. We just like to ask those questions just to make sure that you're safe and we can look out for whatever's here for you. And I do have those orders for morphine and Zofran, so I can go get those if you're wanting them. And like I said, we'll continue to monitor you and help keep you the safest that we can. While you're here, the doctor did get some orders. You can't have anything by mouth due to your admitting diagnosis is acute pancreatitis. This can come from gallstones or from alcohol, and I'm leaning towards alcohol abuse as part of this. So if you are interested, we have community resources that we can get you, like Alcoholics Anonymous, to help give you a support system. And there's one here in town, or there's others in neighboring communities if you don't feel safe going to the one here in town and people knowing that you have a problem. And just some statistics for you. Some studies have shown that greater than 7 drinks a week for women is considered severe, and you're almost hitting that a day. So you are going to have some cardiovascular effects, which is why your heart rate is elevated, you have a little bit of a fever, your blood pressure is elevated, and this in turn can lead to worse problems with your heart, such as heart attack or stuff like that. It can also cause liver and kidney failure because the alcohol has to be processed through something. So those are things to watch for too. And you are a little bit confused, which can be from the withdrawal of alcohol. And if alcohol consumption isn't slowed down, this can be permanent and long term. So we do want to help you, and we are here to help. So we'll do the best we can to keep you comfortable. You'll be NPO, which means nothing by mouth, while you're here, just to help that gut rest. And when you do get to the certain point where your pancreas is ready and your stomach is ready for everything, we'll give you some eternal nutrition if you're not up for a regular diet. So, and like I said, you'll be on bed rest, so we'll just keep you here comfortable in the bed. And the only thing that you can have to drink is when you are taking medicine. So that morphine though and Zofran, the Zofran goes in your mouth, it dissolves in there, so you just leave that in there, and that helps with his nausea. And the morphine will be through IV, so that'll help with some withdrawals and the pain. So is there anything else I can get you before I go? Okay, well, if you need anything, here's the call light, and you can just let us know, and just stay here in the bed and don't get up, and we'll be good to go. So if you need anything, just give us a call, okay?
Okay.
All right.